Dare to look into a world where you are vulnerable. Smile, while the clueless glass shows what it sees, never knowing the beauty that lies beneath.
I've been asked to give a talk about pediatric surgery, my experience as a pediatric surgeon. I obviously am a proud Laguna parent of my daughter, Tamir Keshen, who's in 10th grade here. This is my journey a little bit. When I grew up in Miami, Florida, and I was first introduced to pediatric surgery when I was in high school. In 10th grade, I took an anatomy and physiology course, and I was also exposed to some pediatric surgeries by a close family friend, and I was fascinated by what he showed me, the anatomy, the physiology. What I saw, what I smelled, what I heard was incredibly amazing to me. I volunteered to do some research in high school. And I was also a tutor, and I was a camp counselor during high school. I then went to Virginia for my college experience, and there I continued to pursue my passion. I was volunteering in the pediatric emergency room at UVA, and I continued to do my tutoring for kids. I then went to New York for medical school. I met my wife there as a classmate. And I continued to pursue my motivation towards pediatric surgery. So I did some electives in pediatric surgery, as well as did some research in pediatric surgery, just to feel like I can accumulate additional experience in something that seems so fascinating to me. Following that, I went to University of Iowa for my general surgery residency. It's a 5-year program to learn how to become a general surgeon. And I did pediatric surgery at that time as well. And I also did an additional 2 years of a research fellowship with an NIH grant where I studied pediatric nutrition and metabolism. Following that, I went to University of Alabama, where I did my pediatric surgical training. And that was an incredible experience. And I developed I got to work with some amazing mentors. And then my first job was at Washington University as an assistant professor in surgery and pediatrics. I was there for 5 years, and I also had my own lab, a basic science lab. From there, I came here to California. And for the past 15 years, I've been practicing pediatric surgery here and in Ventura County, as well as San Luis Obispo County. So I've had a wonderful experience here. This is my main motivation, my family. They're the most important thing for me, and they have been a constant source of support and love. They have been incredible in my life, and although I love my patients and I love all the people that I work with, there we go. And this is one of the disease processes in which I care for. It's called a tracheoesophageal fistula. It is an unusual separation between the two ends of the esophagus, which is the main tube that moves fluid and food into your stomach. So the lower esophagus is abnormally connected to the trachea, which is the main airway in which we breathe. And the upper esophagus is a blind ending pouch that does not allow movement of any food, fluid, or saliva. And so we have to reconnect the two ends of the esophagus here and to close the hole in the trachea because we need to breathe. So this is the azygos vein. It's a vein inside the chest that connects with another large vein in our chest. It's called the vena cava, superior vena cava. And in order to access these two structures here, we have to divide that vessel and then clean the connection of surrounding tissue to the esophagus and make an opening here, close the hole in the trachea, and then reconnect the two ends. This is the queen of pediatric surgery. My partner likes to say it's a queen of pediatric surgery. One of the main operations that we do, one of the most complex operations that we do. And it's an incredible experience to do this operation. And many times we're doing it thoracoscopically with the little tiny instruments. I'll show you that video in a second. So there we reconnected the esophagus, and sometimes we use a tube to drain any fluid that collects in the chest. So there's the esophagus, and we're freeing it up from its connection. And now we're clipping the esophagus that's connected to the trachea. We have a tiny camera which is 3 millimeters in diameter, and the instruments themselves are about 1.5 to 2 millimeters in diameter. So we're going through really tiny holes in the chest, and we inflate the chest with carbon dioxide gas, and that expands the space, and it moves the lung out of the way and the heart out of the way. We do it all by watching a screen while we're manipulating the instruments. I need to share with you also my own personal experience over the past year. Last January, I was diagnosed with a glioblastoma. That's a brain tumor. And it was 7 centimeters in diameter, which is about my fist size, and in my left temporal lobe. And I had a stellar surgeon who removed the tumor, and he might be a better surgeon than I am, maybe. But I continue to have therapy now. It was a very scary experience, obviously, and it was strange, very strange for me to transition from being a physician to being a patient. But I think I was a good patient, which is surprising because most doctors are not. But I still am taking chemotherapy. I had radiation therapy, and it has been 1 year since I had my operation. After all this treatment, I did a fitness for duty examination at UCSD. It was a 5-day examination for fitness for duty. So I had been poked and prodded. They assessed my brain function, my ability to think and demonstrate executive functions, and also to demonstrate my surgical skills. And I've been given approval to return to clinical work, so I'm very excited about that. I'll probably start in March, so I'm very happy to return to what I love doing. So what I find important is to find joy in the everyday. And I love taking care of kids. I love helping them. I love doing bread and butter operations like hernia repairs and removal of lumps and bumps and removal of gallbladders and intestinal work and lung operations and liver operations. I love sharing my skills, my knowledge, my soul with my patients, as well as my residents and students and my colleagues and staff, and obviously with my family. I was introduced to the 3 A's by my father-in-law. I find these to be 3 pillars of success. I need to demonstrate my affability. If I'm not kind and nice to my patients and the people I work with, it's not good. Availability. I need to be available pretty much at all times to be able to provide my services. And aptitude, obviously my skills and ability to be a pediatric surgeon. I'm super thankful to my family for giving me their support. Thank you, Roberta, my wife, my 4 kids, Kendall, Nathan, Olivia, and Zachary, and all of my colleagues and friends and staff. They have been wonderful to me. I just want to read something real quick, and then I'll get off the stage here. I promised my daughter that I would not read her letter, but I didn't promise my son. So here, here goes. 1 year. We love you so much, Dad, and your strength this year has been incredible. To watch you go through all of this and keep your head up really makes it an honor to be your son. I'm so grateful that we have been given this year and I'm hopeful for what the future brings. Love you so much. Stay strong, Nate. I get teary pretty much all the time I think about this, but they're so amazing. This is my family here, and we were on Thanksgiving. We were in New York, and this is the ferry to the Statue of Liberty. And on the surface, it looks like we're very happy to be with each other, and beneath the surface is a tremendous amount of gratitude for my life and for my family and everybody in my life. And I only hope for you all that you can find the gratitude for your lives and what you do and the people around you. That is my hope for you and my hope for myself. Thank you very much. I appreciate you allowing me to speak. And to the TEDx team, thanks again.